Hello students, welcome to Science and Tech series with Dr. Vivek Rana. We'll be decoding important topic from prelim perspective, and topic for today's discussion is from medicine or biotech section. So we'll be decoding word xenotransplantation. Now, xenotransplantation is a theme which is making headlines for, you could say, mixed reasons. There are times when it is hyped like it's a new scientific breakthrough. At times, it faces its share of criticism. So, we'll be decoding what exactly is this term, why it is in news, what are the different types of similar terms which you need to differentiate, because this is the potential theme once again from film perspective. At times it might be accidentally, we would say, small part can be asked in ethics section as well. So the ethics of transplantation, and more specifically xenotransplantation, is going to be theme for today. So without wasting any time, let's first of all understand why we are covering this theme. So couple of months ago, this landmark, you could say, medical intervention of xenotransplantation was carried out in one of the patients who had a kidney failure. So basically what they did was they used a pig kidney which was modified using CRISPR-Cas9, so that there is no longer an immune rejection from human body, and it was transplanted in that patient. So that person has survived for 2 months, but unfortunately after 2 months person died. There is no immediate linkage that he died mainly due to the rejection part. So in a way, initially for 2 months this theme was celebrated as a new milestone in medical intervention, because if you could cross the species barrier, because indirect way it represents cross species transplantation, which is rarest of rare thing. Because last year also we had seen a heart was transplanted from pig to a human being, and once again the person collapsed within 1 month. But in a way we are on cusp of a major scientific breakthrough where we could even cross the species barrier, overcoming the hurdles of immune rejection, and make human life a little longer than it actually is. So basically, so first of all, the word xenotransplantation is nothing but whenever the transplantation is being carried out between two different species, because this is a major scientific barrier. Generally, the immune rejection is harshest in when you try to implant any organ or a tissue from one species to another, because our immune system has some antibodies which typically act against any foreign ailment which tends to enter it. Now, why this theme is important, organ transplantation? Because we see that there are a lot of accidents, a lot of times some diseases or ailments tend to affect a large segment of people, and due to some ethical barriers, that those patients do not adequately get the real-time donors. So we need to bypass the conventional method of transplantation so that life could be saved in such complications. So organ transplantation, or you could say transplantation, is nothing but grafting from of a tissue, cell, or an organ from healthy person to another ailing person, so that his journey might be prolonged. So typically this method is practiced in 4 different ways. As you could see on the blackboard, there are 4 different types of grafts which are theoretically possible. The most common one is the autograft, then we have the isograft category, then we have allograft, and more precise the final term which we have just decoded, xenotransplantation or xenografting. And apart from these 3 words, the xeno is the one probably if you might be finding new one. So xeno, it theoretically represents anything which is foreign, or you could say unusual in nature. Now, first of all, let's decode these 4 terms. Now, term autograft represents type of graft in which has the reputation of highest success rate, minimal complication. So basically, it's nothing but when a single part is damaged, especially a skin or some other tissue of one part of the body is damaged, and we use another part of body to transfer cells so that that part may be damaged. A typical scenario could be a burn injury or some scar mark, and we tend to transplant tissue from some femur or a thigh part and then transplant it to the part which is visible. So in such transplant, since the tissue or the cell is being transplanted from the same human being, so it has higher success rate. There will be no immune rejection and there is no ethical controversy regarding it, because the person has individual choice to restructure his body as per the requirement. So we can say autograft is the graft between same individual. Now coming to the isograft, in this you must have heard about at times during the childbirth, identical twins are born, and more or less their not only morphological but physical features are quite same. Also in behavioral themes as well, there is quite a similarity observed. So when a transplant is carried out between two identical twins, more or less the success ratio happens to be on the brighter side of the scheme of things, and those immune transplants are once again easily accepted across the body. So isograph, with the iso word, you can easily link with identical twins. But then the anomaly is identical twin itself is a rarity. So we cannot just, medical system cannot just rely on this method of transplantation. Also at times, due to some complications in relationships, a person may not be easily ready to donate a part of his vital organ, because we have seen that there are some organs which are easily transplanted, like skin, cornea. But if we look at a larger picture of skin, especially the organ part, because cells tissue tend to be easier to transplant, but it's the organ transplantation which is the burning theme. So three organs which are most commonly transplanted happens to be kidney, liver and heart, and these are the themes which sadly represent the most required parts during the you could say comorbidities or medical complications. So we can say the isograft is a good option, but only for identical twins. Now the practical aspect, coming to the practical aspect, the transplant which is taking place in lot of private hospitals, or you could say government one, is the allograft. In such scenario, a close relative or an immediate family member is transplanting a part of his organ tissue for a successful health of ailing patient. So such transfers, when taking place between two human beings, or you could say the same species, such types of grafting is referred as allograft. So basically here the human barrier is tried to overcome, because once the blood is involved, a lot of rejection tend to be unsuccessful. So that's why informed consent is quite necessary, and you need a willing relative who happens to have a similar blood group and antigen, so that despite taking the risk, it should not backfire for the patient, and lot of interventions are required for such type of graft. So these grafts are at times in news for some controversial reasons, because we have seen lot of hospitals getting exposed for running the organ rackets, because these are the transplant where at times some people from rural or lower socioeconomic strata are lured for economic incentive in search for the kidney transplant. So basically at times allograft receives its share of criticism, and there are certain ethical issues which are linked with such transplants. And coming to the final part, the xenografting. Now in this case, you are trying to bypass the species barrier. You tend to choose some animals which have similar physiology, or at least the chromosome gene makeup, and happen to be from same larger order called mammalia, so that the chances of immune rejection can be minimized, even though it happens to be a dreaded barrier. But as we are discussing this current theme, that at times the pig is being the chosen one for these experiments, or some monkeys, it happens to be such transplants are called the xenotransplants, where you are bypassing the natural barrier of species and trying to save a human life through extra scientific measure. So such type of transplants are risky. There are ethical issues. and there are at times limited success ratio as well, because we are, just as we discussed this current affair, the heart transplant lasted for 1 month. The kidney transplant, which we are covering in this week, once again collapsed within 2 months of such transplant. But nevertheless, these are foundations on which the science is going to build over the years, and CRISPR-Cas9, the gene editing tools, are making it possible to modify such species to extend that immune reaction from the body can be minimized, to extend that the transplant happens to be an optimum. Now, when you are covering such transplant, the ethics themes also comes into the picture. Basically, there are three ethical dimensions when such transplants are being carried out in xenotransplantation. The first pertains to the animal rights, the second pertains to human rights, and third pertains to the interference with nature. Now, coming to the animal right parts, though the ethical dilemma is straightforward, that animal is being reared, it is being raised, it is being modified without its consent, and eventually it is being sacrificed. So the question arises that in order to fulfill your self-interest, you are sacrificing an animal, you are playing with its genetic makeup without its consent, and then into the worst form of animal cruelty, that it's death. Because in case of heart, or you could say some vital organ, the animal needs to be sacrificed. But then the proponents of this technology argue that this animal was raised in scientific labs, and more important, that animal cannot be equated with the ailing patient who has a bright future, especially say there's some young patient who would require, who has a life to sport, is being saved through this scientific intervention. What's the ethical wrong in it? So basically, the animal rights or environmentalists are not too satisfied with this argument, and they argue that right to life is not the sacrosanct for human beings. Animals also have equal rights, and they should not be supposed to be experimented without their consent, or tortured, or used to be killed for sake of saving that noble individual. So basically, the first major issue of animal rights is quite a strong one, which at times raises a whole question mark about this procedure at the first place. Coming to the second dimension of human rights, it's mainly related to informed consent. We have seen a lot of individuals, when they are in such medical complication, they do not get opportunity to take decisions that what is to be done with their body. At times, the individual might not be comfortable with the idea that a different species heart or an organ was transplanted to his body to just sustain his life, because at times the religious, social, economic reasons tend to be backfire, and that could be a traumatic experience for a person to live his remaining life with a foreign or an alien part which he never intended to. And also the illegal rackets at times operating at the time makes the allo and xenograft a quite controversial one. At times the person are not guided about the potential complication or the risk involved with the organ transplantations, and they are lured with some easy money, and they tend to just get carried away and regret this decision. At times, we have seen some nefarious private hospitals treating some poor patient and unintentionally taking some organ or a kidney, because a lot of these themes are there. And also the cadaver donations at times are controversial. Some dead bodies, or due to time intervention in clinical and recurrent death, are being misused to serve the interest of rich patients. So in those scenarios, such transplants or grafts tend to become controversial. And the final ethical controversy is the interference with nature. At times, nature has programmed us to be biological distinct. There are reproductive barriers as well as immunological barriers which were created intentionally to keep things apart, but human beings tend to act like God, and they are justifying all such experiments in name of saving human life, or trying to prolong, or trying to be immortal on this earth. So that's another moral dimension, that why are we once again interfering with the rules of nature for such scientific breakthroughs. So you can say these three grounds of ethical dimension make such topics a bit controversial one, and once there is a controversy, the scientific breakthrough does not get the requisite, you could say, acceptability, and some nations at times tend to lag behind in such breakthroughs, and a lot of you and debate are raised for such things. So I hope you are now clear about the four types of transplantation, what are the ethical dimensions of the issue. And another question that might be coming to your mind is, why was the pig chosen at the first place in such scenario? Now pig happens to belongs to the same mammals to which human beings belongs, and then it is organ size happens to be similar to that of human body. Otherwise, if you look at the elephant, blue whale, or you say they we can experiment with the rat or squirrel, the size of the organ is not matchable. So only animal which comes close to the size happens to be the pig one. Also, the molecular, genetic, and protein structure has some similarities which can be easily modified as per requirements of emerging technologies like what we have just mentioned, CRISPR, Cas9, other editing tools which are making such you could say transplantations possible, which at times was called that they were tales of mythology or fables. So human beings are crossing all the scientific barriers to make life more adaptable and more prolonging the average lifespan of individual, but still we are far away from such landmark breakthroughs. So let's hope the science keep on evolving, but at same times it respects the boundaries of nature, and you could say the has some minimal controversies to address, because anything without acceptability of major section tend to not win heart. We don't have to just cross barriers, we also have to win acceptability. So if you have any specific query regarding this transplantation theme, also make sure you go through your NCRT, because there is a specific chapter in which they have mentioned which are the organs which are easily transplanted, what are the conditions of transplant, from one single transplant how many lives can be saved, and also which are the diseases, especially like if someone is suffering from some blood related disorder, they are prohibited from donating to the organ, whereas the gender, sex, or age has nothing to do with the transplantation. Any person who has given the informed consent can be part of it. So thank you very much for once again sticking with us, and we'll be back soon with another science or environment update. Stay tuned. Have a nice day.